Now, this is a follow-up testimonial about a year after our surgery, but why don't you describe to me what was the situation before the surgery?
Well, I had fallen and I had pain and I tried to manage it at home for about, 2 weeks. And it was clear that it was not getting better. And of course, I knew you from working in the ER over at Alex and, so.
So you had this fall, you had this pain, and how bad was the pain before after the fall?
9 of 10.
Yeah, I remember you came here, we got some X-ray, we got some CAT scan, and then I got really concerned.
Yep.
I remember I put you right in a very not rigid brace.
Right.
Because literally your bone was breaking and falling apart, and part of the bone was pushing on your spinal cord.
Yep.
As well, we noticed that your activity was very, very limited. As a matter of fact, you weren't walking anymore, right, before the surgery, right?
Very little, no.
So yeah, so what do you remember?
Well, basically, I was, the way it happened was, I was up at night and didn't have the lights on. And we used to have, God rest her soul, God rest his soul, an elderly black lab. Well, he's 140 pounds, and he used to get paranoid, and he wouldn't hear me until I was on my way back to the bedroom, and we have a hallway going there, and he knocked me into the corner.
You fell,
and
yeah.
I fell flat on my ass,
Oh my, yeah. So for weeks, for how many weeks weren't you walking before the surgery?
Oh.
How many weeks did it take from the fall?
Walking normally, or?
No, generally, I mean,
2 to 3, and then
2
we
to
came
3.
here, yeah.
Yeah, okay. And then we noticed you have a broken bone. And then we decided that is unstable. We wanted to take you to the
Exactly.
surgery.
Yeah, I remember the conversation
Yeah,
with you.
yeah. But then, the day of the surgery, the anesthesiologist came to me and said that your liver situation and your coagulation situation is very dire. And, he literally looked at me and said, he'll die of surgery. You cannot do that surgery. Where I had to explain to him, this is not the open old-fashioned surgery he's used to. When he read that we are going to do that many levels of the fusion and so on, he was used to having that a 12-hour surgery with a gallon of blood loss. But and he wanted to cancel your surgery even though you were going paralyzed. What could you do with your legs just before the surgery? What were your ability to do using your legs before the surgery?
Not a hell of a lot. I could walk.
You were losing function.
Walk along the walls and get to the bathroom and things like that.
Yeah.
But in terms of any meaningful function, zero.
Yeah, well, your platelets were very low.
Yep.
Your coagulation was not in a great shape, and we were in front of a very difficult decision. First of all, do we just, not do the surgery, in which case you would have gone paralyzed, or do we go and do the surgery and take the pressure off with OLLIF technique? Open surgery would have been an absolute no in your situation, and the anesthesiologist would have been right.
It's like my daughter, I mean, my oldest 2 daughters, no evidence of it, but my youngest daughter, and I guess there's a family history of other people.
Has the exact same symptoms.
Has the same
So
thing.
there's some liver problem, some coagulation problem, and so on. But either way, we decided, together with the anesthesiologist that, we don't, the risk of the surgery with the OLLIF technique are justified because the alternative would have been, letting you go paralyzed.
Right.
So we did the surgery. Now, how long did you stay in the hospital after the surgery?
2 days.
Oh, no, a little bit longer. 4 days, maybe?
4 days, but
Yeah.
that was a big surgery. And how long after the surgery did you start walking again?
Well, grandson,
Mhm.
we drove back to where we live,
Mm-hmm.
and I walked unassisted up the steps.
Okay, well, so within weeks we regained the function back, is that correct?
Yeah.
Now, pain was a big problem as well before the surgery. How bad is your pain now? Or in the area that we did the surgery, how bad is the pain that you had before the surgery?
Oh, it was like 9 or 10.
Before the
That,
surgery,
yeah,
yeah.
that
Before.
pain, how bad is that pain now? Or after, how bad was it after the surgery?
It went down pretty much immediately.
Okay. And that is the surgery that what we did, you know. We did a multi-level, this is a new CT, and we decided instead of doing a corpectomy, we want to just fuse the place, the broken bone, bridge it with metal on each side like this, and sort of give your back a support and rely on what we call anatomical and physiologic decompression rather than try to do a corpectomy, lose a gallon of blood. And the surgery that we did, actually, I'm having the data, was under 2 hours.
Yep.
And in your situation, obviously with your coagulopathy, our blood loss was 641. This is exactly was my word to the anesthesiologist, that even if we
remember
lose
that.
10 times more blood than usual, we are still okay. Which is exactly that's what we did. We lost way more than in a usual surgery. Because in a usual surgery like that, I use 150 cc of blood for so many levels. We lost about 4 times more than usual, which is 640. But what we need to understand, if you do a 1-level open old-fashioned fusion, that's how much blood you lose in somebody who doesn't have any kind of,
Right.
complication, liver problem or coagulopathy. So this is the only way we could get the surgery done. And, just your story that you regained the function, your pain came down from that level, says that it was really worth it. And this is a surgery that can be done where no other surgery in the spine is really safe to do.
Yeah, no, I agree.
Yeah.
It was, and, even in my unpracticed
Mhm.
eye, not being a radiologist or.
Yeah, but you're an emergency doctor,
The
correct?
the bone is
Yeah.
resorbing,
Yeah, the bone that was protruding out, it seems to be absorbing, and but more important than that, your symptoms are getting better.
yeah.
It, the once the bone is
Well,
stable,
I
yeah.
I had PT and they
Mhm.
gave me exercises to do, and I've been pretty much religious about it,
Good. That's
And,
a good thing. Yeah.
and it seems to help a lot.
Yeah. Absolutely.
Oh.
No physical therapy. No.
He
Well,
needs to go back though,
We
John.
will,
You
we will.
need to go to a
no.
real.
It's the problem with the broken bone is that you cannot do a physical therapy with broken bone. So
Right.
obviously, once we stabilize that, then we can use lots of other tools
Yeah.
to get you back on your function. And no other surgery could have made you stable in
No,
this
I-
way.
It
Yeah.
didn't take a rocket scientist to take, when
Yeah.
I first saw those x-rays,
Yeah.
and you said, well, you thought they were a little unstable. I said, oh,
Oh,
geez.
yeah. Well. Any other comment as well on your side? Anything else?
No,
A
I
question
think-
you have? No.
He's losing function again now, but I
But that
think
is-
it's because it's
Mhm.
the surgery
Mm-hmm.
is a success. I mean,
Yeah.
it's, but I think because of our situation with me having to be gone so much with
Yeah.
our daughter,
Yeah.
who was so ill, and he has fallen a little bit more. And I think because of
Mhm.
that,
I haven't taken any severe falls. I
Yeah,
mean,
yeah.
just,
But as well, we noticed that you have a new problem.
exactly.
You have a sacroiliac disease, and we know that up to 43% of the people who have a spinal fusion, they have as well in the future of that sacroiliac problem. And you do have a sacroiliac problem, but that is a much easier problem
To
to deal
manage,
with.
yeah.
Okay, you have as well knee problem, you have gout, you have other joint problem.
Yeah.
Unfortunately, I
It's a
didn't make
mess.
you, no, I didn't make you younger, but we have to just dissect the situation, take one
in fact,
problem at
I'm
a
at the
time.
point where I wonder whether it's the back
Mhm.
or knees.
Yeah.
Now you said sacroiliac,
Yeah, and
That
we are
makes
going to
sense.
inject that, and we have good solutions
Good.
for that. But the point I'm trying to make is, we identify one problem, we fix it, and we move on. And some of my patients, they think that solving one problem is going to solve all the future problem, but it is one problem at a time.
What I, and again, I'm not a medical
Mm-hmm.
doctor, so I don't know this, but what it's done though, is we've
Mm-hmm.
solved the problem, you've even said your back's not bothering you.
Yeah,
But we've identified another issue, and kind of zeroed in on something else that
yeah.
can be
and
fixed.
yeah, and that is the new issue that you're having is your sacroiliac joint. My provocation test is positive. We are going to put some steroid in, and sometimes that can actually fix it.
Good,
Okay, so we're going to move on, but you don't have to be afraid that you will be paralyzed anymore, because that problem was solved with a surgery that was under 2 hours. That would have been impossible with any other surgery. Okay.
And
Well-
you don't think it's a negative thing that I'm still using the
No,
walker?
no, I think I want you to be safe.
Okay.
You're regaining function and so on, but you have soft bone, so I think you have to just be safe. You have other problem in other joint that make you more prone to falling. Sometimes when we get in the advanced age, we just have to live with the body we have and adjust our life to that. And you using that is a safe thing to do. You and I, both of us, we are never going to be younger, but
yeah,
as long as we are mobile, as long as we can do certain things, we can still find meaningful things and enjoyment and so on. We are not going to be 30 anymore, both of us.
exactly.
Yeah.
Okay?
I think the other thing, and I hope you don't mind me bringing it
Mhm.
up, I think, he can take no pain pill, like he can't take
Yeah,
Advil.
because of the liver
ibuprofen.
situation, yeah.
Because of the liver situation,
Mhm.
he can take none of that. So
I mean, I take one Paralysis a
Yeah.
day.
Okay.
do you think it is worth it for him to take some sort of, because then he gets very anxious
Mhm.
with the pain,
Yeah, yeah.
very anxious.
Yeah.
Like some sort of anti-anxiety, like a Valium or something like that he
Well,
can
I don't
tolerate.
recommend Valium because Valium make your reflexes slows down and
Okay,
make you prone to fall. But there are some other medication like the Visceral or Flexeril or other things that can help you.
Yeah,
But,
you prescribed me Flexeril before, but I can't tolerate that.
Yeah.
I mean, it's like,
Yeah.
gotta take one
Now,
pill.
another
go to
thing
sleep
that
for 2 days.
hopefully is going to be all legal in the entire United States soon is that the medical cannabis, can have
Exactly.
very good effect on pain management and so on. And we doctors have known for a long time that can help patients and so on, and definitely safer than most of narcotic and so on.
we have to go. I'll be honest with you, you can turn that little thing on.
Yeah.
Our son-in-law is a medical marijuana grower in
Yeah.
California.
Here you are.
And
Well, I don't need to turn it off. This is in
No,
California.
great,
It's
great.
legal.
No, he's
And here,
a
hopefully, will be legal
medical
soon too.
marijuana grower, and in fact, I was thinking about that the other day. I don't know
Mhm.
why, you did use it a little bit for a while, and
Yeah,
it helped,
Mhm.
did.
and we need to go back to that.
Yeah, I think it's a good idea. Okay. Well, thank you so much for the interview. This
There you
has been
go.
really helpful. Thank you.